Hello everyone, my name is Dr. Ken from Faculty of Veterinary Medicine, Chiang Mai University. First of all, I'd like to thank Dr. Ratapan for inviting me to give an introduction on abdominal pain in elephants. And this presentation is specially made for WU International Workshop for Elephant Medicine and Surgery, which will be conducted on 16 to 18 September of 2020. Sorry to have to make this presentation in English because the title of the workshop is Said International. So what is abdominal pain? So it is also can be called acute abdomen or colic. It is a pain originating in the body cavities, including thorax, abdomen, and could be in the pelvic cavities. Example of the pain originating from thorax may be including tuberculosis and pulmonary abscess. If it's happened in the abdomen, can be abnormalities in the GI tract, liver, pancreas, or even kidney. If it's happened in the pelvic cavity, maybe the abnormalities is in the urinary bladder or reproductive tract, such as the pain from ovulation. Based on the previous study conducted by Dr. Ankawanit, had demonstrated that the gastrointestinal problem is also one of the leading cause of the illness in elephants. And when we look at the number between 2005 2008, it's very clear that the GI problem is one of the most important that cause the elephant need admission as the hospital. The data of the data from Dr. Ankamani also correspond to the information from the elephant database. So this is all the 16 diseases of the elephant that died due to colic, and the latest case is on 2019. So based on Schmidt in 1986 and Troy in 2001, they had described that the colic in elephants can be classified into two types. The first one is obstruction and the second one is spasmodic colic. So the reason that I think they or he described that spasmodic colic in elephant is very common because if the elephant is being fed by lucerne hay too much, it can cause spasm. So we don't have to worry about this problem because lucerne is the legume that grow only in the temperate zone, so we don't have that. But some people may be imported that, so just have to be aware. So next, I'd like to talk about the nomenclature of the colic in elephant. So most of the elephant vet that I know, they call it bloat. So I would like to propose that we shouldn't call colic in elephant as a bloat. So why? Because bloat is the definition is the excessive gas or fluid accumulation that causes by excessive eating or drinking to the volume that the GI tract cannot handle it. However, bloat also can occur after the incident of GI problem. For example, like obstruction of the GI tract and then GI tract cranial to the obstruction site usually have the abnormal of the peristalsis. That's why it can cause bloat. And probably the clinical characteristic of the sign that most people see in when the elephant get colic is the distension of the abdomen, which is kind of like similar to the clinical manifestation of the cow. So it's possible that the term bloat is adopted from the cow. But however, when we call all colic in elephant is a bloat, it also affects the decision of the diagnosis and also the treatment. So I think maybe it is good time to reconsider and rename it, and it shouldn't be called bloat.